Okay. Good afternoon, everyone. Okay. Good afternoon. Good afternoon. Good afternoon. Thank you for all your time and attention today during our conference. Believe it or not, we have made it to the end of our fifth annual conference. So while today's programming has ended, it felt like it flew by, right? The work does not stop here. This is only the beginning. I am pleased to report to you all that we had a total of 1,872 people registered today, a record number and our largest group ever. Thank you so much to my amazing team: Judith, Marlene, Lily Snape, Lily Schneider, Megan Lamb, Tia Bellatot, Raya Barnes, Tiffany Vassell, all our amazing volunteers that have given countless hours, minutes, text messages, emails, threads, FaceTime calls to get this thing planned. Thank you. So, throughout the day, you've heard from various speakers about legislation related to maternal health. We've also referenced the advocacy toolkit. Thank you to my amazing Mother Lab. Shout out to our Community Engagement Advocacy and Policy Committee, the Market and Research and Communication and Events Committee, and our Research and Grants Committee, and all the work that's come out of Mother Lab. Thank you to everyone who has volunteered, everyone who has made this happen in all parts of this conference. I want to talk to you a little bit about some of the amazing quotes that we've heard today. You must really think about who is leading a commission and to notice the presence of structural racism in policies. You can still be positive and cause racial harm. That was from Rep. Liz Miranda. I propose to you all today that as we go through Maternal Health Week, as we think about the role policy plays in addressing maternal health outcomes, that the only way to change the order, the only way to change the outcomes is to do something different. If there's one thing I want to leave you with today, poor maternal outcomes are not a pregnant woman's problem. Next quote: call your senators and then call even more senators to make sure the momnibus passes. Next quote: there is nothing wrong with Black women. The only thing wrong is the environment. Racism as a root cause drives racial disparities in birth. Anti racism is a lifelong journey. We need to make a commitment to learning and unlearning racism. Our country's maternal health crisis existed long before COVID. Black and Indigenous birthing people deserve to be honored and valued. This is a crisis, but this is preventable. So many of our speakers said that today. Of all the forms of inequality, injustice in health is the most shocking and the most inhumane. That's from Martin Luther King, Reverend Dr. Martin Luther King. So whether you joined us as an undergraduate student in your first year of college, as so many people are here, freshmen, sophomores, undergraduates, masters, doctors, MDs, PhDs, somewhere in your educational journey, community health workers, birth workers, doulas, clinicians, policymakers, whether you're an undergrad or a seasoned professional, I hope that today has left you feeling empowered, educated, energized, excited to contribute to policy and advocacy efforts, both nationally and or within the state you reside. Drop your state in the chat. If you leave here today with only one message in mind, let it be this: we must be actively involved in systemic change, including policy change to improve maternal health outcomes. So, from participating in grassroots organizings where you live, to getting involved in advocacy groups that exist in your state, to looking up and contacting your state and federal government officials, there are countless ways to get involved to drive change. I invite you to keep up with our work after the conference, mainly through the Mother Lab, March, the Maternal Child Health Journal Club, and the plethora of other projects and events our brilliant members and colleagues are leading. Please visit motherlab.org to learn more. I would like to end my remarks and the conference with some exciting news. This is very, very fresh, hot off the press. It's coming, it's here. The Center for Black Maternal Health and Reproductive Justice, that has been a dream of mine for years, will be launching here at Tufts University in the School of Medicine. The proposed center will be developed and will be an extension of the work of the Mother Lab. The vision and rationale of the Center for Black Maternal Health and Reproductive Justice is to protect the Black birthing experience by advocating for quality, equitable, and respectful care in childbirth. The center will create a world where Black women can safely, efficiently, and comfortably receive equitable access to healthcare services without having to navigate through racism or discrimination in medical settings. The Center for Black Maternal Health and Reproductive Justice envisions all interdisciplinary research will be integrated with faculty from Tufts schools and across the country. Please follow Mother Lab and BMMTufts social media accounts for more information on the socials from the center in the coming weeks. Now, before I end, I would be remiss without thanking once again our amazing sponsors at the Ally, Gold, and Diamond sponsorship levels: Organon, Neighborhood Birth Center, Robert Wood Johnson Foundation, and the March of Dimes, respectively. Today's conference would not be possible without you and our other sponsors. Thank you. I am pleased to report that as of today, we have raised $89,000 for our conference. I'm so grateful. I'm so honored. Thank you again for a very successful and informative conference today. Get ready. Next year's theme, you heard it here first, is the role of midwifery in addressing Black maternal health inequities. It will be held on Friday, April 7th, 2023. I'm already excited and looking forward to what we are hoping will be an in-person conference next year. Take good care. I look forward to seeing you in a networking session, and thank you again. Someone closing us out.
Hi, everyone. Thank you again, Dr. Amutah, for that amazing closing. We're so excited for what's to come. Next year's conference theme sounds phenomenal, and the work does not stop here, just like you said. So we are so excited for what's to come and what we can learn about what Mother Lab is going to be doing and everything else. So I just want everyone to keep an eye out for their emails. After today's conference, you will be receiving the toolkit. Look for updates on our website. There is so much more information that is going to be given to the audience. We thank you so much for registering and getting us to 1.8 thousand people registered for this amazing conference. So informative. So we're going to be sending you PowerPoints. Next week we will be uploading our YouTube, all of these videos to our YouTube. So please look out for that. We're so excited. So for our last activity, we will be doing a networking session. During this activity, you will be able to chat one-on-one with other attendees. You will be given 5 minutes to chat with them, like a speed dating session. And then you will randomly be selected to go with another new attendee. If you choose to connect with that person, press the connect button, swap information, and continue to connect after this conference. There's no telling who you can meet in this room. From a student to a clinician, there's so many things you can learn from each other. We learned so much from Mother Lab today. So please keep your minds open, chat, talk, and don't feel obligated to stay. When you finish, you can head out or continue to switch through to different attendees. So once again, thank you so much for attending this year's 5th Annual Black Maternal Health Conference. We truly thank you, and we hope that you have a blessed weekend. Bye-bye.